Hi everybody, it's Bonnie. I'm back to talk to you a little bit about nursing. So, anyways, today's Tuesday. I just had my research class, which is not fun. If you've taken it, I'm in research too. It's kind of a fluff class. I understand we need to know about evidence-based practice, but definitely not my favorite class. So I figured I'd talk to you guys a little bit about clinicals. This past weekend I had my complex alterations in nursing clinical, which is basically med-surg 2. I was on the cardiac floor, and I had a gentleman that had had open heart surgery a week ago. He also had he had mitral valve stenosis, so he had a stent placed, and he had his xiphoid process removed, which I'm sure, as you know, you don't often hear of that. I had never heard of it. My teacher had never heard of it. So we kind of asked him why he had this removed, and he said it was because he had pain in his xiphoid process from a boxing injury when he was younger. So that was kind of interesting. So this week, basically what I did with him was I got to give Lovenox injection, which, if you know about Lovenox, you give it in the love handles. And it's a sub-Q injection, so you want to like hold the love handles between your hands. You want to make sure, if it's a pre-filled Lovenox syringe, that the bubble of air that's in it goes in last. Very important. This gentleman had a PICC line, so I had to flush before and after with normal saline. And of course, when I went to flush the second time, I was squeezing the air out of the syringe that the saline was in and squirted it in my face. So things like that do happen, but, you know, patient laughed, I laughed, and we got through it. I also cleaned his, where he was opened up from the surgery, the sternotomy, with betadine. I ended up getting betadine everywhere. So these things, you know, they do happen. This patient was really cool. He was understanding. I passed meds. Didn't have to bathe this patient or anything. He was pretty independent, actually, although he did have fluid in his lungs. And they were trying to figure out the cause of that because his white blood cell count was extremely elevated. So they were thinking maybe pneumonia. So listening to him, he had diminished lung sounds on the right-hand side. It was interesting. He was a good patient. Let's see, my other clinical I had over the weekend was mental health. And I was on the floor of the hospital where it's mostly patients that have checked themselves in with depression, some bipolar, just kind of a mishmash of things. And for that clinical, I had a patient who had actually just lost her job. She had a history of kind of suicidal tendencies. She had lost her parents, both her parents at the age of 17, and she was middle-aged. So she lost her job. She wouldn't say why she lost her job, but she lost her job. And she came in because basically what happened was she came home from work that day after she got fired. She couldn't get her garage door open. Went into her house. She had no electricity. I don't know if she didn't pay her bill. I'm not sure what happened with that. She took a bunch of Xanax and drank a quart of, not a quart, but drank like a bottle of whiskey, I guess. And then she says she doesn't remember what happened after that, but she ended up slashing one of her wrists, broke her foot, had a laceration over her eye, busted her nose. I mean, this lady was in rough shape. And basically what we did was I went in and tried to talk to her a little bit. She wasn't super open to talking, but I did get her to come to a couple groups. So for mental health, basically you get assigned a patient or you self-assign a patient. I chose this patient. I worked with her a little bit, and then I took her to groups so she would kind of socialize with some other patients. And the groups are kind of neat because you get to see the dynamics between the different people. And then you have to write a whole bunch of care plans for both of the clinicals. There's a lot of paperwork. That's the only downside, but clinicals themselves are a lot of fun. Now this semester is my 3rd semester, and I'm in an accelerated program, and it's gotten really tough. Not gonna lie. 3 semesters in, it's rough. But let's see, what do I have this week? I have a quiz for research, I have a quiz for mental health, and I have a test for MedSurg 2. And I have to write a 5 to 7 page APA style format paper on obsessive compulsive disorder. And this is kind of all due this week. So it's doable, but it's... Oh, and I have a research midterm next Tuesday. So definitely have to organize what I'm going to be doing for the rest of this week and get myself all in order. But yeah, once you kind of figure out your groove and you figure out how the teachers test and everything, it does get a little easier. But I've been trying to like exercise and eat right too to just kind of make things a little bit easier on myself too. So today I went for like a 4-mile walk, but then I ate a bunch of junk food. So that's not the best thing to do, but it's steps. It's baby steps, the whole thing. So anyway, I'm looking forward to hearing what you guys are doing. And if you have any other questions I can answer about clinical or, you know, doing different skills or anything like that, definitely looking forward to hearing about that. So anyways, that's all I can really think of now, and I actually have to go read for mental health for that quiz. I have to read 2 chapters. But yeah, I look forward to hearing from you guys, and I hope you have a great week.